Coming of Age is coming up next. I'm your host, Josh Newby. First today, we'll talk about heart surgery. The hub of our human bodies requires delicate care and expert precision. And we'll hear about that fascinating process today with Baptist Healthcare. We'll also give you some tangible steps to keep that ticker ticking with exercises you can do right at home in the time of COVID. Stay with us. Coming of Age starts right now. As we age, staying active in life and involved in the community can become a challenge. But with Council on Aging of West Florida's range of home-based services, you remain healthy, independent, and engaged. From Meals on Wheels and respite care to senior dining sites and the retreat, you'll feel empowered to regain your freedom while retaining what makes you, you. We've been in the community for nearly 50 years, advocating for elders and supporting those who care for our parents and grandparents. We were there when your father's health began declining, when your mother needed companionship during the day. And guess what? We'll be there down the road when you need those services too. Now, join with us as we talk together about the aging issues that matter to you. In 1896, British surgeon Stephen Paget said, "Surgery of the heart has probably reached the limit set by nature to all surgery. No new method and no new discovery can overcome the natural difficulties that attend a wound of the heart." Well, the advances in cardiovascular surgery made over the past 125 years has definitely proved him wrong. Today, a tremendous number of heart defects and disorders can be corrected with surgery. With us today, just in time for Heart Month, is Dr. Russ Ronson, a cardiothoracic surgeon with the Baptist Heart and Vascular Institute. Dr. Ronson will bring us up to date on treatments offered through surgical procedures for the heart. Doctor, thank you so much for joining us today.
All right, thanks.
Dr. Ronson, first tell us about yourself, your background, and your training.
Well, I'm a cardiothoracic surgeon here at Baptist Hospital and Baptist Heart and Vascular Center. I came here from Birmingham, Alabama, where I was for almost 19 years at a busy medical center there. I began my training at the University of Texas. I went to Dartmouth Medical School from there. From there, I went to Emory and did general surgery and some cardiovascular research, and finally finished my training at University of Virginia, where I did cardiac, thoracic, and vascular surgery, and came from Virginia to Birmingham, where I was for the first half of my career, I guess.
Excellent. Tell us a little bit more about the Baptist Heart and Vascular Institute.
It's comprised of cardiologists with specific expertise in cardiothoracic and vascular surgeons. It really has four pillars to be able to take care of patients in a way that's fairly unique, certainly here on the Gulf Coast and really in most places. It's the surgical side, myself and my partner, and then there's an interventional that perform diagnostic tests and stents and things of that such. There's a electrophysiology pillar where have heart rhythm disorders are their expertise, and then in general cardiology, where ultrasound and echoes and nuclears and general heart problems can be seen. So it really encompasses very well all the aspects of cardiovascular disease in a very organized fashion that allows specific expertise. It's based here at Baptist Hospital, but it has fingerlings all over the Gulf Coast and inland where patients can be treated and seen, getting that same level of expertise.
What are the most common heart disorders that you see in patients that can be fixed with surgical procedures?
So most of what I do is cardiac surgery, where we do bypasses, or a cabbage as it's commonly called, go around blockages on the heart valve repairs and replacements. We deal with any surgical disease for cardiac arrhythmias or abnormal heart rhythms. Any tumors or growths in the heart we treat, and really what we brought down now to the local areas, the complexity of what we do, and not having to go and travel to get the most contemporary and um, treatment can be done right here locally.
Okay, and tell us about some of those procedures that helped correct those issues.
Well, the standard procedure surgically for blockages on the heart, which causes angina or chest pain, is a cuttingedge or a coronary artery bypass grafting, where we go around the blockages and get blood to the heart where it needs to get to, preventing heart attacks. Procedures for valves are anywhere from open valve replacements via traditional incisions, or certainly smaller incisions on the chest or even the groins, where we can replace valves now, which is much easier on the patient than the conventional, or for lack of a better word, old-fashioned way.
Interesting. So, what are some of those new cutting edge procedures you talked about?
So I would say that the really three things that we do, maybe four things that we do that are relatively new in the last couple of years, is heart valve replacement through the groin. For certain valvular diseases, aortic stenosis being the most common, we can now replace valves and correct patients through the groin with a one-night stay and getting just sedation. Other procedures also done through the groin with catheters. We work on the mitral valve and fixed mitral regurgitation. So I know lots of folks have heard mitral valve prolapse or mitral valve regurgitation. That can often, not always, but often be treated without ever picking up a scalpel or making an incision. It's simply, again, a one night stay and sedation. Other procedures of certain heart rhythms now can be dealt with if they've had failed treatment with medicines, or ablations by needles and wires. We can do those through very small incisions, treating atrial fibrillation, very common problem in the community now, with very good results. And really, lastly, there's a lot of catheter-based techniques with suction devices and debridement devices, where we can, if somebody has an infection on a heart valve, or if somebody has an infection on a pacemaker, we can get rid of that using a suction device through the groin, as compared to conventionally opening the chest. And we're really the first ones on the Gulf Coast that are doing that. We brought that down from Birmingham with us, but it's been very successful, and really, again, being able to treat people locally that may have not had that option prior.
And do any of these procedures require an inpatient stay? Can they be done with outpatient procedures? What does that look like?
So most of what I do is inpatient. All of open heart surgery requires a several night stay, typically one night in the intensive care unit and a few nights on a regular private room step down. I know lots of folks have memories of maybe their parents or siblings 20 years ago, where you used to be in the hospital for 2 weeks. Now it's really mostly a few days. Most of the heart surgery, although it's been done, maybe some of the valves that we do through the groin might go home the same day, but really most are at least a one night stay.
How does someone know if these procedures are appropriate for them?
So typically somebody has a symptom of some kind, whether it be an infection of the heart causing a fever, or shortness of breath because their heart or heart valves are not working, or chest pain, where they present to either their primary care doctor or an emergency room facility, or if they have a history with a cardiologist or their family member does, where somebody would do diagnostic tests, either chest x-rays, ultrasounds of the heart, sometimes an arteriogram, and they would filter it through and triage it to the appropriate people. But really, the most common symptoms and ways that people get to us are either abnormal EKG, or an electrocardiogram that's done on a routine physical, or somebody has a symptom of shortness of breath or chest pain that prompts further workup.
Great information. Where can our viewers learn more about the Baptist Heart and Vascular Institute?
So the website of ebaptisthealthcare.org is really a good resource to do that. But really what I encourage people to do the most is talk to their physician. If they're not feeling well, if they're having symptoms, if they're noticing fatigue or shortness of breath, get evaluated and let the physicians make their decision as to what should, if anything, needs to be done. In the era that we currently live in, people are nervous to go to a doctor or go to an emergency room, and I would really encourage people to get evaluated in the same way that they always would. We have precautions and safety, and you hate to miss things that are fixable because we're nervous about other things. And really, what I'd like to convey to folks is that the treatments that we have now here at Baptist and in our local community are the most up-to-date, most complex, technologically advanced therapies for heart disease anywhere. Going to a bigger city or somewhere else is no longer needed. We have the most up-to-date equipment to see things and do things without actually touching them or feeling them. And the complexity of disease that we're now able to take care of in terms of people who may have been told, well, you need to go to a center because your heart doesn't work well or because you've had prior heart problems. That really is not the case anymore. And we can certainly have the ability and expertise and experience to take care of that right here locally, which makes it much easier on the patient and their family.
Great information, Doctor. Thank you so much. Next, stay active in the new year from Safe at Home.
Why do people love ACT's retirement life communities? There are more reasons than just the active lifestyle. Like ACT's Life Care, a plan that protects your nest egg with predictable monthly fees, even if your healthcare needs increase. So you can enjoy a carefree today and a worry-free tomorrow. Plan a visit and see why our satisfaction rating with current residents stands at 98%. ACT's Retirement Life Communities, where loving kindness lives.
Since 1989, TLC Caregivers has been providing the special help people need to stay independent in their own homes. TLC is an employer of choice in the home care market. Our employees are screened with level 2 background screens, drug-free, and have caregiving experience. If you have time, enjoy people, and are interested in joining us, go to tlccaregivers.com to learn more about becoming a TLC caregiver or visit us in Cordova Square.
When cancer tries to take you away from the things that matter most, Baptist Cancer Institute offers caring physicians and the most innovative treatment options. With convenient locations and a wide array of support programs and services, we're here to help you during the most difficult of times. As a member of the Mayo Clinic Care Network, we're bringing even more innovative cancer care to our community right here at home. When you need cancer care, we'll be there.
As social isolation stretches into the new year, it's important to stay in shape, not just so you can boast about sticking to your resolutions, but also to keep your body in good condition as the pandemic wears on. But you don't need a gym or even expensive home gym equipment to work your muscles and get your heart rate up. John Fitzgerald and Blake Pablo are here to show us an easy routine for which all you need are your floor, some chairs, and a desire to be better than yesterday. Gentlemen, thank you for joining me.
Thanks for having us. This is Blake from Island Doctors and John Fitzgerald with Anytime Fitness. If this is the first time seeing us, we are out there in the community offering a free exercise class twice a week in Pensacola at the Bayview Community Center at 9 a.m. on Tuesdays, as well as in Milton at the Community Center at 10 a.m. on Wednesdays. And if you've never heard of Island Doctors, we're a primary care alternative geared towards improving your health, having better health outcomes, and quite frankly, spending more time and attention with you so you can live a happier, healthier life. John, what are we here to do today?
Thanks for asking, Blake. Today we're going to do 4 exercises. The classes that Blake mentioned primarily focus on range of motion, strength building, and of course fall prevention. So today we're going to show everybody about 4 lower body exercises a quick cardio routine you can do at home, and then finally 2 balance drills that, again, you can do anywhere. As you see, the only thing we have are 2 chairs. They don't even have to match.
That's right.
This is all you need. The number one excuse Blake and I hear in the community is, Blake, John, I don't have any equipment. With our class, no equipment is necessary, so just follow along. Good to go?
Good to go.
All right, so the first thing we're going to do, we are going to start sitting down. The first exercise we're going to do are called chair squats. This is the most important exercise we do. We're going to stand up, but we're going to do it smartly. So the first thing you want to do, and I'll move my chair around a little bit so you get a good angle, is you want to have your rear end on the edge of your seat. You want to have your feet in front of you, obviously, about shoulder width apart. Technique, how we do this is important. So we want you to lean forward. We want you to get your nose over your toes. We want you to press through your heels. My hips come forward until I'm in a full standing position. Pause and then reverse. Make sure your rear end goes in the chair. And then repeat at your comfort level. Again, we're not jacks in the box. We're not going for speed. What we are looking for is that up-down motion, utilizing these quadriceps and these big glute muscles, these rear end muscles. Now the reason this is the most important exercise we do is a couple of things. One, like I mentioned, it utilizes these big quadriceps, these big glute muscles, big powerful muscles. Plus, as we go from a seated to a standing position, our core muscles, our balance muscles have to become engaged, and it helps maintain or improve our balance. Lastly, this is what we call a functional movement. Everybody, hopefully, gets up and down. Blake and I got into a car, came in here, sat down, went about our day. If you cannot do this basic motion, your mobility is going to be limited, and therefore your quality of life. Let's do one more, Blake.
Yes, sir.
And remain standing. So again, chair squat. Make sure you start in that forward lean position to get your weight forward. Stand up. If you don't remember anything else from today, do that exercise. 3 more lower body exercises. Today we're focusing on the lower body because obviously that's primarily where our balance occurs. Next exercise, now again we have the chairs here. These are not crutches.
Nope.
These are for your confidence, stability if you need it. We worked our quadriceps and our glute muscles. Next we're going to work our hamstrings, these muscles top back part of your leg. Now again, I'm in a nice standing position, I'm nice and straight. My feet pretty close together. I want to bring one heel up toward my rear end, then put it back down, and then alternate. Now again, you can see, and thank you Blake for illustrating, he was doing it in free space. He didn't have any hands on the chair. I do have my hand on the chair, again, to make sure I'm nice and stable. We certainly don't want you falling during a fall prevention exercise drill.
So that's a problem?
That's a huge problem. Now,
Good to know.
As you can see on both our knees, they're right beside each other. That's what you want to focus on. Blake illustrated the knee going forward. You don't want that to happen. You're working the wrong muscle. We want to exercise that hamstring, that big muscle top part of your leg. My foot that's moving, it is flexed. And you can even put your hand on that hamstring and feel it working. One more. And we're nice and straight. We're not doing this. And relax. Good, good, good. Deep breaths, deep breaths. Now Blake and I are still beside our chairs. The next exercise we're going to do is called marching in place. This is exactly what it sounds like. Again, now you can put your hands in free space or hold on to the chair. But at the end of the day, I want you to bring one knee up towards your chest, put it back down, and repeat. At your pace. We're not running in place yet.
Nope.
Not yet. That
We're
comes
getting
later.
there.
We're exactly. Stay tuned.
Yep, get excited.
But on this, nice and easy, moving that one knee up towards your chest. Obviously, we're focusing on the hip flexors. The whole purpose of the hip flexors is to bring your foot off the ground. It's called ground clearance. One reason seniors trip is they don't pick their feet up high enough.
That's right.
Over time, those muscles atrophy, become weaker, and eventually, we take a spill. So this simple exercise will keep those hip flexors nice and strong, plus mentally remind you to pick your feet up. So
it'll get us to whatever place that you're talking about.
Absolutely, absolutely. Because if you don't pick your feet up, you're going to trip on curbs, sticks, small dogs,
grandchildren.
Grandchildren. And again, we're nice and straight, bringing that knee up, not our chest to our knee. A couple more. And relax. Good, good, good. Now, last lower body exercise. Blake and I call this the big four.
Yep.
We're going to work our calf muscles, these tiny muscles back part of your leg.
Tiny for him.
Thank you. Thank you for pointing that out.
You're welcome.
My feet start together. I'm nice and straight. I'm simply going to go up on my toes, get my heels off the ground and pause, and then back down, and then repeat. Nice and steady. Do it with a purpose. We're not bouncing up and down. Blake, show them what not to do. That's no good. If you want to jump rope, we can do that later.
Yeah.
But this is a nice, smooth motion, pausing again at the top, and then back down. Now, if this becomes too easy, you can always take one leg, wrap it, or one foot, wrap around the other ankle, and go up on that one foot. Clearly, that's more challenging, but if you do that, make sure you do the same number on both feet. Again, nice and easy. And kind of like Blake was talking about earlier, these calves are ignored, but they help propel us from point A to point B. More and more seniors are getting run over in crosswalks because they're walking too slow. One reason these calves are not properly conditioned and they don't go fast enough.
Yep.
Now you may feel that nice burning sensation, right? That's lactic acid. That's a good thing.
Yep.
One more, Blake. And relax. Now, so 4 basic exercises: chair squats, leg curls, marching in place, heel raises. Keep those major muscle groups in our legs strong.
Yep.
Should translate to better mobility and better balance. Now, cardio.
Yay!
Cardio, cardio, cardio. We love cardio. Cardio is anything to get your heart rate up. Best way to burn fat.
Yep.
All right, so we're going to run in place, but we're going to do it smartly. So we're going to get behind our chair. Again, we have this here for stability. Now move mine out of the way. Our feet a little wider than shoulder width apart. Now I'm going to get into what we call the football stance. And then I'm going to move my feet as quickly as I am comfortable, staying primarily on the balls of my feet. My heels barely, if at all, touch the ground. And I'm taking, both Blake and I are taking nice, tiny baby steps to keep it low impact, protect my knees, my hips, and my back. But I'm moving those feet as quickly as I can to drive my heart rate up.
Yep.
Our heart is a muscle, and just like any other muscle, it has to be challenged. That's how it becomes stronger. Plus, as I mentioned, cardio is one of the best ways to lose weight or maintain a good weight.
Yep.
If you've fallen victim to the quarantine 15, and that's a real thing we can talk about at a later date,
Oh, yeah.
this is one way besides a healthy eating habit.
Which we can help you with at Island Doctors. If
Absolutely.
your primary care is not helping you with your nutritional needs, we incorporate that as part of our primary care.
You got it. You got it. Head off those problems. Weight gain has a lot of bad consequences. And relax. Deep breath. Now in our class, Blake and I are always reminding you, breathe, breathe, breathe. And people are like, well, that's easy. Sometimes during exercise, we see people, right? No bueno. Don't hold your breath. So cardio and then 2 quick balance drills, because again, we want to challenge our balance muscles.
Yep.
First exercise, again, deep breath. Take your right foot, put it in front of your left foot, heel to toe, like you're on a balance beam. Then get centered, have that weight equally distributed between both feet. And then try and balance on that narrow base of support. And now, again, I'm heel to toe, just like I'm on a balance beam. Now your hips may move. That's fine. That's your core muscles waking up and engaging. All right, that's perfectly normal. Now again, we have the chairs beside us. If you want to keep a hand close to that chair, even slightly tapping it, that's perfectly acceptable, and relax. And then obviously, alternate. Take your left foot, put in front of your right foot, and again, get stable. Don't lean back or lean forward. Get that weight distributed. I'm nice and tight and balanced. Now you may find one side is easier than the other. We're left-handed or right-handed dominant usually. So one side may be easier than the other.
And for those of you that are like, get tight, what do you mean? Like get uptight, get rude? No, that's not what we mean. What we mean is you want to engage your core. Think about pressing your belly button into your spine and visualizing your abdomen muscles stacking on top of each other. When that's all engaged, you're stronger, you're more stable.
Absolutely.
Things just become easier.
Absolutely, and relax. Last balance drill, the most challenging balance drill. Keep your left foot on the ground. Put your right foot on your ankle, not your knee, your ankle. Again, engage that core, and then focus. Now, as you can see, my foot is wobbling. Those are called micro adjustments. The added bonus of this exercise, besides obviously challenging our balance muscles, since all of my weight is supported by one leg, it's also an excellent strength builder. All right? And relax. And then obviously alternate. Let's keep our right foot on the ground, left foot our ankle. Again, don't rush it. Engage that core. We're looking forward, right? We're not looking at the ground. You don't go through life looking at the ground. You want to be up. Breathe. Sometimes it helps if you find a spot. Now again, Blake and I are both in what's called Tai Chi pose. If you want to have your hands out, that's fine. Just don't put them in your pocket and relax. So again, the classes that we do, again, at Bayview on Tuesdays at 9, in the Milton Community Center Wednesdays at 10. We follow the same pattern because, again, science shows a prescribed routine has better results. But if you just do those few simple exercises, we promise you, we've been doing this for what, 4 years?
Yep.
Your balance and your strength and hopefully your mobility and quality of life will improve. If we can help you, let us know. Josh, we certainly appreciate it.
Thank you, Josh.
Excellent. Thank you guys. And until next time, enjoy life. You've earned it.